Structures under gluteus maximus. So this is the dorsal surface of the hip bone. We have gluteal lines, anterior, posterior and inferior gluteal line. Now just behind this posterior gluteal line is the origin of gluteus maximus. The muscle also takes origin from lateral slope of dorsal 1/3 of iliac crest, which is inserted into the gluteal tuberosity of femur. So what are the structures under the cover of gluteus maximus? The bones are ilium, ischium with ischial tuberosity, greater trochanter of femur. So this part of the femur is covered under the gluteus maximus. Now what are the joints? It is sacroiliac joint and hip joint. Now moving on to ligaments. The ligaments present beneath the cover of gluteus maximus is sacrotuberous ligament from ischial tuberosity to sacrum, and sacrospinous ligament from spinous process, that is ischial spine to sacrum. These ligament covers the notch, greater sciatic notch and lesser sciatic notch into greater sciatic foramen and lesser sciatic foramen. Now what are the muscles which are present beneath the cover of gluteus maximus? So it is medius minimus. Now piriformis. This is auricular surface of ilium. Just below that is preauricular sulcus. The piriformis takes attachment from sacrum, few fibers from preauricular sulcus. These fibers are attached to the tip of greater trochanter. This piriformis is considered as key muscle of gluteal region. So this is attachment of piriformis to the tip of greater trochanter. There are few muscles, vessels, nerves above and below the piriformis. Above the piriformis is superior gluteal vessels and nerves, below inferior gluteal vessels and nerves, and few more structures. Next to piriformis is obturator internus with 2 gemelli. So this is pelvic surface of obturator foramen. Here the muscle which takes attachment is obturator internus. This muscle passes through the lesser sciatic notch and gets inserted into the medial surface of greater trochanter. The tendon of obturator internus, when it passes through the lesser sciatic notch, here it takes attachment in the upper part of medial surface of greater trochanter. Above and below the tendon of obturator internus is superior and inferior gemelli. Just above the ischial tuberosity, this region gives attachment to quadratus femoris. Ischial tuberosity gives attachment to hamstring group of muscles. This is the outer part of obturator foramen. So here obturator externus takes attachment and gets inserted into the trochantric fossa. So these are the muscles which are present under the cover of gluteus maximus. Let's see all the structures in detail. So this is the dorsal surface of hip bone and femur. Here on the dorsal surface, we can see 3 gluteal lines. Behind the posterior gluteal line is gluteus maximus, which is inserted into gluteal tuberosity of femur. So all these structures are present beneath the cover of this gluteus maximus muscle. All bones, ligaments, joints and muscles. Between posterior and anterior gluteal line is gluteus medius. Between anterior and inferior gluteal line is gluteus minimus. What are the bones which are present beneath the gluteus maximus? Ilium, ischium with ischial tuberosity, greater trochanter of femur, part of sacrum, coccyx, These are the bones. Now what are the ligaments which are attached? From tuberosity to sacrum, sacrotuberous ligament. From spinous process to sacrum, sacrospinous ligament. So here is the ligament attachment, sacrotuberous and sacrospinous ligament, which converts the greater and lesser sciatic notch into greater and lesser sciatic foramen. So these are the bones and ligaments. Now what are the joints which are present beneath? It is hip joint and sacropelvic joint. Now moving on to muscles. Here is the attachment of piriformis. In hip bone it is attached to preauricular sulcus, whereas in the femur it is attached to apex of greater trochanter. This piriformis is considered as key muscle because it separates the structures above and below the piriformis in the gluteal region. Now next to piriformis, there are some muscles attached to the medial surface of greater trochanter, which are obturator internus with 2 gemelli. So this is tendon of obturator internus. The obturator muscle takes origin from the pelvic surface of obturator foramen. The tendon passes through the lesser sciatic notch. This tendon of obturator internus is accompanied by 2 more muscles called superior gemelli and inferior. 2 more muscles called superior gemelli and inferior gemelli. These 3 muscles are attached to the upper part of medial surface of greater trochanter. Just beneath the surface is trochantric fossa, which receives attachment of obturator externus. This muscle takes attachment from dorsal surface of obturator foramen. Just below that we have quadratus femoris. Quadrate tubercle is present in the intertrochantric crust. It takes attachment just above the ischial tuberosity on the dorsal side. Below quadratus femoris is attachment of hamstring muscle, which takes origin from ischial tuberosity. So these are the muscles under the cover of gluteus maximus. Now what are the vessels and nerves? Above piriformis and below piriformis we have structures. Above it is superior gluteal vessels and superior gluteal nerves. So above piriformis, superior gluteal vessels and nerves. Below piriformis, from lateral to medial, this is the thickest nerve in the body, which is called sciatic nerve. Just medial to it we have posterior cutaneous nerve of thigh, then inferior gluteal vessels, inferior gluteal nerve, then medially we have pin structures, pudendal nerve, then internal pudendal vessels, then we have nerve to obturator internus. So these are the structures which passes through the greater sciatic notch just below the attachment of piriformis muscle. Now we have 2 more anastomosis beneath this gluteus maximus muscle. One anastomosis near the trochantric fossa called trochantric anastomosis. One just below the lesser trochanter, just below the attachment of quadratus femoris, is cruciate anastomosis. So what are the vessels involved? The vessels involved are medial and lateral circumflex femoral vessel, which are branches from profunda femoris, which is a branch of femoral artery. Now for trochantric anastomosis, these 2 arteries gives ascending branch of medial circumflex femoral artery, ascending branch of lateral circumflex femoral artery on either side. Now from above we have superior gluteal vessels, so branch from superior gluteal vessel, and from below we have inferior gluteal vessel, a branch from inferior gluteal vessel. So this is about trochantric anastomosis. above superior gluteal, below inferior gluteal, on either side, ascending branch of medial and lateral circumflex femoral vessels. Now coming to cruciate anastomosis. This anastomosis is at the level of medial and lateral circumflex femoral artery. So they give transverse branches. And from above, a branch from inferior gluteal vessel. From below, ascending branch from first perforating artery. Perforating arteries are branches of profunda femoris artery. So these are the two anastomosis beneath the cover of gluteus maximus. Now let's summarize. So what are the bones which are present under the cover of gluteus maximus? So it is ilium, ischium with ischial tuberosity, greater trochanter of femur, part of sacrum, coccyx, now what are the ligaments? It is sacrotuberous ligament, sacrospinous ligament, ischiofemoral ligament. Now what are the joints which are present beneath the gluteus maximus? Hip joint and sacroiliac joint. And now what are the muscles? So just beneath the gluteus maximus is gluteus medius, gluteus minimus. Below inferior gluteal line is reflected head of rectus femoris. Then we have piriformis. So from apex of greater trochanter to pelvic surface of sacrum and preauricular sulcus. Just beneath the piriformis is tendon of obturator internus with superior and inferior gemelli. And just below that we have obturator externus, which is attached to trochantric fossa. It is trochantric fossa. And just below that we have quadrate tubercle in the intertrochantric crust. Here quadratus femoris is attached, and just beneath that we have hamstring muscle which is attached to the ischial tuberosity. So these are the muscles beneath the cover of gluteus maximus. So the muscles are below gluteus maximus, we have gluteus medius, gluteus minimus, reflected head of rectus femoris, piriformis, obturator internus with two gemelli, superior and inferior, obturator externus, quadratus femoris, origin of hamstring group of muscles in the ischial tuberosity. So these are the muscles. Now what are the vessels and nerves? Above and below piriformis we have few vessels and nerves. Above superior gluteal vessel, below inferior gluteal vessels and nerves, plus few more nerves. So the vessels and nerves are above piriformis, superior gluteal vessels and nerves. Below piriformis from lateral to medial, we have thickest nerve, sciatic nerve, then posterior cutaneous nerve of thigh, inferior gluteal vessels and nerves. Then we have pin structures, pudendal nerve, internal pudendal vessels, and nerve to obturator internus. Just below all the muscle, we also have quadratus femoris muscle here. So there is a nerve which supplies this muscle called nerve to quadratus femoris. So these are the bones, ligaments, joints, muscles, vessels and nerves. And we have two more anastomosis beneath the cover of gluteus maximus. One is trochantric anastomosis near trochantric fossa, cruciate anastomosis just below lesser trochanter. So about trochantric anastomosis, Above piriformis we have superior gluteal vessel, below piriformis we have inferior gluteal vessels. So branches from superior and inferior gluteal vessels, and branches from medial and lateral circumflex femoral vessels forms trochantric anastomosis. So for cruciate anastomosis, branches from inferior gluteal vessel, ascending branch from first perforating artery, and two transverse branches from both circumflex femoral artery. So let's see in detail. So what are the two anastomoses? First one is trochantric anastomosis. The arteries involved are superior gluteal artery, inferior gluteal artery above and below. On either side, medial circumflex femoral artery, lateral circumflex femoral artery. Both are branches of profunda femoral artery. So now branches from all these four arteries forms trochantric anastomosis. Next one is cruciate anastomosis. This occurs at the level of medial and lateral circumflex femoral artery. So we have transverse branches of both medial and lateral circumflex femoral artery. Above, branch from inferior gluteal artery. Below, ascending branch from first perforating branch of profunda femoris artery. So these are the structures which are present under the cover of gluteus maximus. Thank you.